Wrap the cuff around the arm such that the bottom edge is about 2 to 3 centimeters above the crease of the elbow. The cuff will have a marking, usually an arrow, which should be aligned to rest over the approximate location of the brachial artery. In order to avoid problems with the auscultatory gap, the systolic pressure should first be estimated from the pulse obliteration pressure. This will also help to prevent an unnecessarily excessive cuff inflation that will be uncomfortable for the patient. To do this, ignore your stethoscope just for a moment, and instead place 1 or 2 fingers over the radial pulse. Once you are confident that you can feel it, turn the valve to the closed position and slowly inflate the cuff until the pulse disappears completely. The pressure at which that occurs is approximately the systolic pressure. Once you have an estimate for the systolic pressure, place the stethoscope over the brachial artery, which can be aided by tucking in one edge under the cuff. Inflate the cuff to 30 millimeters of mercury above the pulse obliteration pressure, and turn the valve to the open position just enough to decrease the pressure by about 2 to 3 millimeters of mercury for each heartbeat. At one point, you'll begin to hear the cord cough sounds. Even though the sounds may not initially be constant, the pressure at which you hear the very first thump is the systolic pressure. Continue to slowly lower the pressure. At some point, the sounds will abruptly become muffled, and just a little bit below that, they'll disappear altogether. Although in the past, some experts recommended using the muffling pressure as the diastolic pressure, general consensus is currently that the pressure at which these sounds disappear completely should be used instead, as it's easier to identify and thus is more reproducible. Continue to lower the pressure for at least 10 millimeters of mercury below the disappearance of sounds to ensure that you have accurately identified the diastolic pressure. The procedure should be performed at least twice. The final recorded blood pressure should be the average of all readings taken in the same sitting, rounded off to the nearest 2 millimeters of mercury. You may observe the gauge needle beating within the same range of pressure as when the cord cough sounds are present, and it may be tempting to use this visual observation as a surrogate for auscultated blood pressure. However, this is not advised since there may not be complete agreement between the needle's oscillations and the cord cough sounds. After measurement is complete, don't forget to tell the patient the result, as they will likely be anxious to know it.
To monitor your blood pressure using an automatic blood pressure machine, sit comfortably for about 5 minutes before taking the measurement. Make sure your back is supported, feet are flat on the floor, legs uncrossed, and roll up your sleeves if needed. Then place your arm on the table, palm upward, even with your heart. Then place the cuff on your arm 1 inch above your elbow pit. Make sure the artery line or the tube falls in front center of your arm. And wrap the cuff around with the appropriate snugness. The cuff should be placed tight enough so that you can fit 2 fingertips at the top end of the cuff. To get started, press start and remain still and quiet as the machine is measuring. The cuff will inflate and slowly deflate to get accurate measurement. When the reading is complete, the machine will display the blood pressure reading and pulse. Record your numbers daily, either by writing it down in a journal or entering it into your phone or laptop.
Before we start, could I ask you to roll your sleeve up, please?
Yes.
And now I'll place this on your arm. If you just pop your arm by your side for me, that's perfect, thank you. So first, I'm going to inflate the cuff while having a feel of your pulse at the wrist. Is that okay?
Yes.
If it's too uncomfortable, just let me know. Great. How was that?
A little tight, but not uncomfortable.
Are you happy for me to do the same thing again?
Yes, of course.
This time I'll listen to your pulse with my stethoscope. Great, that's complete. I'll just take the cuff off for you.
Select an appropriately sized cuff for their upper arm. This is a cuff that will wrap around their arm completely. It should not be too tight or too loose. Keep a note of which cuff size you use for which person. Line up the arrow on the cuff marker with the centre of their arm. Warn the patient that the cuff is going to become tight on their arm. Press a button to start filling the cuff with air. Then wait for all the air to come out of the cuff. The BP will appear on the monitor. Record this reading in their notes.
Do you have any history of high blood pressure, low blood pressure?
No, I think it's been pretty normal.
Okay. Any history in your family?
No.
All right. So I'm just going to take your pulse first. Okay. I want you to raise your hand all the way up, as high as you can, and just pump your fist 10 times. Just going to recirculate the blood. Great. Okay. Just rest your arm down. Perfect. Just going to slowly release. Okay, so your blood pressure is fine.
So what you're going to do is you're going to try to see if you can find a pulse on the brachial artery. It's usually towards the inside of their elbow, around here. And you kind of just take a little mental note of that. And you're going to wrap the cusp around their arm. Keep it snug but not super tight. You just don't want it to have it loose and wobbling around. So you put these in and put the head of the stethoscope right where you had that pulse, and double check to make sure this is all the way tight. And you're going to squeeze. And by doing this, you pump air into the cusp. Essentially what you're looking for is when you release the air, you'll see the dial go and you'll begin to hear thumps, usually around 120. That's just kind of an average. Some people might be a little higher, a lot of people are lower than that. And what you're hearing here is the first thump is their systolic pressure, so that's when the heart has contracted and that's their highest pressure. And you'll continue to hear light thumps, and the last thump you hear is the second number you record, and that's their diastolic pressure. And that's when the heart is relaxed and it's refilling with blood.
Now that my patient's blood pressure cuff is on, it is on securely. It is on approximately 2 inches above the bend of his arm. It's not too tight, but it's also not too loose, so it's not sliding up and down the place. And the reason why you want to make sure that your blood pressure cuff is not on too tight is because you do not want to occlude the brachial artery. Now I'm going to take my stethoscope and I'm going to place it on my patient's brachial artery. Now for this, you can use either the diaphragm or the bell of your stethoscope. It really does not matter. I personally like to use the diaphragm. However, the bell is known for hearing low tone pitches, so the bell will work amazingly for this. Now what I'm going to do is I'm going to gently place my stethoscope over my patient's brachial artery, and you want to make sure that you're pressing down hard enough so that you can actually listen for the pulse, but you do not want to press down too hard because you do not want to occlude the brachial artery. So now that my patient's blood pressure cuff is on, my stethoscope is over the brachial artery so that I can listen for my patient's pulse. Now I'm going to take the balloon so that we can puff air into the actual blood pressure cuff. And I'm going to make sure that this knob is turned just enough so that air can go in and out of the blood pressure cuff. So now I'm ready to pump air into my blood pressure cuff. Now as I'm pumping air into the blood pressure cuff, it's tightening up on my patient. So now I have pumped up air into my patient's blood pressure cuff. You see that the gauge is kind of stuck there because I have not yet released the air in my balloon. Now I'm going to go over this more in the next portion of this video where I'm showing you guys what to actually listen for. But when you're taking your patient's blood pressure, you're going to want to make sure that you puff up enough air in the blood pressure cuff for your gauge to be going approximately 20 to 30 millimeters of mercury above what your patient's average systolic blood pressure is. And if you are not sure what your patient's systolic blood pressure usually is, you can go ahead and get a gauge for that by palpating the brachial artery before actually placing the cuff on your patient. Now I'm going to go ahead and demonstrate puffing up your cuff one last time because I want to demonstrate how you should release the air in the blood pressure cuff. So now you want to make sure that air is being released steadily and slowly, approximately 2 to 3 millimeters of mercury per second. As you can see, the gauge is not going straight down. The gauge will go down about 1 millimeter of mercury and then it'll puff back up for a second. That is the blood pressure cuff feeling the brachial artery. And when my stethoscope is attached to my patient's brachial artery, I will be able to hear it. Now in the next portion of the video, I'm going to be showing you guys exactly what you should be listening for when you're taking your patient's blood pressure manually. So I'm going to be demonstrating exactly what you should be listening for and what you should be watching for when you are taking your patient's blood pressure using a manual blood pressure cuff. Right now, I am using an online simulation called iHuman, and it is through Kaplan. So I do have a virtual patient that I am taking care of. I have blacked out my screen and I have zoomed in on the manometer just in case anybody watching this happens to get assigned the same assignment. I don't want you to know what patient I am taking care of. So really quickly, I'm going to go over all of the parts of this virtual blood pressure cuff. The actual cuff itself is missing from this screen, but we can say that it is attached to the patient and it is placed properly. And then we have right here our inflation bulb, or bulb for short. Right here we have our air release valve, or we can just call it the valve for short. And then of course this big screen here is our manometer. And right here is the manometer gauge, or just the gauge for short. So in order to take the patient's blood pressure, just like in real life, I'm going to squeeze or click on the inflation bulb. And I want to make sure that the gauge gets high enough for us to be able to record the patient's systolic pressure. Now my computer is currently muted, but I'm going to turn my volume on so that you can hear exactly what I'm doing. Please keep in mind that I am dealing with a virtual patient right now, and you will be able to hear my virtual patient breathing. So if you hear heavy breathing, it's not me, it's my virtual patient. So now I'm going to go ahead and squeeze the bulb. Okay, so I went ahead and squeezed my bulb and the gauge is now stopped between 180 and 200 millimeters of mercury. This is pretty high, so I'm confident that this is higher than my patient's systolic blood pressure. You can see that the gauge is paused in position right now because all of the air is trapped inside of the blood pressure cuff. In order to release the air and listen for my patient's blood pressure, I'm going to be clicking on the air release valve. Now in the simulation, of course, since this is online, I'm just going to be pressing this button, and then air will slowly be released so that I can be able to determine and record my patient's systolic and diastolic blood pressure. However, in real life, you will not have a button. It will actually be a knob that you turn. So you want to make sure that in real life, when you're taking your patient's blood pressure, you are slowly turning the knob to slowly release air from the blood pressure cuff. If you release air too fast, it will be almost impossible to actually listen for your patient's systolic and diastolic blood pressure. You want to make sure that you're listening for the patient's heartbeat. So when I first release air from my valve, the gauge is going to slowly start decreasing, and I will hear nothing but air releasing. At some point, I will start to hear my patient's heartbeat. When I hear the very first heartbeat, I know to record that as my patient's systolic pressure. My patient's heartbeat will continue as the gauge continues to decrease, and at some point my patient's heartbeat will stop. I will no longer be able to hear it. And the very last heartbeat that I hear is what I will record as my patient's diastolic pressure. So I'm going to go ahead and record that. Please listen very carefully and watch very carefully. Remember, you're listening for the patient's first and last heartbeat. So I'm going to go ahead and turn the volume back on. You're going to hear my patient breathing. You're going to hear air being released from the blood pressure cuff. And beyond all of that, please listen for the first and last heartbeat. Okay, so if you were not able to determine the blood pressure of the patient, that's okay. I'm going to go ahead and inflate the bulb one more time, release the valve one more time, and allow you to listen very carefully to listen for the first heartbeat and the last heartbeat. Okay, so again, I'm going to release air from my air release valve, and I want you all to listen for the very first heartbeat that you hear up until the very last heartbeat that you hear. Again, the first heartbeat will be your systolic pressure, and the last heartbeat will be the diastolic pressure. So the patient's very first heartbeat could be heard at 121 millimeters of mercury, and the very last heartbeat could be heard at 79 millimeters of mercury, giving your patient a systolic pressure of 121 and a diastolic pressure of 79, meaning that your patient has a blood pressure of 121 over 79.
Make sure the artery is pointing where you felt the brachial artery. And the cuff is snugly on snugly, comfortable for the client. Is it comfortable for you? You don't want it to be too loose. You could place the manometer on the hook here. And you could fold this so you could see the manometer and you could read it. The evaluator will have one of the headpieces for the stethoscope. Will be listening at the same time as you. Put the earpieces inside your ear. Hold the diaphragm between your fingers. Do not use your thumb because you will be listening to your own pulse. Place it on where you felt the brachial artery. You could feel it again to find the location. Now with your dominant hand, you want to hold the valve and close the valve, closing it towards the right clockwise all the way, and you'll start pumping. Pump it until you the arrow will be pointing in between 160 to 180. As you're releasing, you are releasing 2 to 4 millimeters of mercury per second. You are listening quietly for the systolic, which is the first sound, and the diastolic, when the heart rests, which is the last sound that you hear. Once you hear the last sound, the diastolic, you will release the valve all the way to 0. Remove the stethoscope. Okay, thank you, Ms. Smith. We are finished. Remove the blood pressure cuff.
That's sort of heart level. Okay. Blood pressure's 110/72. It's really good.
I'm going to put this around against the artery. Okay, and just relax your arm down. So we're going to increase the pressure, and I'm just going to check your pulse as we do so. Okay, so I can feel the pulse there, and that's about 120. We're going to do the same again now, but I'm going to listen to confirm the noises. And just relax back. That's fine. So that's 122/70. And we should change over to do your other arm if we might. Put that on. Okay, and just bring that. And just relax back for me. Okay, we're going to do the same again. So just taking your pulse. And we're just going to confirm that with the stethoscope. So just relax the arm back. Okay, done with greater detail. That's about 128 over 70. Okay, so those blood pressures are certainly good for your age.
Hello. How are you today? Good. Please have a seat for me. Okay. So Ms. Rago, I'm going to check a couple things. I have your chart open and I see that you're not allergic to anything, correct?
Correct.
Can you please verify your name and date of birth for me?
Sure. Name is Amrita Rigo and date of birth is September 15th, 1986.
Perfect. We would want to check that with our armband. That's correct. And I see you have no previous surgery. There's no reason that I cannot get a blood pressure on either extremity, correct?
Correct.
All right. What is your blood pressure typically run?
It's usually 120 over 80.
Wonderful. So I'm just going to do some hand hygiene. I would provide privacy. So I'll close the door, pull the curtain. And what I'm going to do, I first am going to palpate your brachial artery. So remember, the brachial artery tends to be in the inner arm, more towards the inner side of the arm. So she has a very, I can easily palpate her brachial artery. It's actually a +2 rating on the scale of 0 to +4. And we're going to take our blood pressure cuff. And, excuse me, Ms. Rago, line my equipment together. And we are going to make sure to put that arrow that says artery mark and palpate it one more time if you can't remember where it is, and put it 2 inches above. And you want to make sure you have a nice, good fit. Do you see how much cuff is left over? It's more than 20%. This is a well-fitting cuff for Ms. Rago. So I'm going to put my sphygmomanometer where I can visibly see it, because this is what I'm going to have to read, okay? And remember, we said righty-tighty. So go ahead, screw it all the way to the right, and I want you to loosen it just a little bit, because if it's too tight, when you try to deflate while you're assessing their blood pressure, it will deflate too fast. So righty-tighty, loosen it just a little bit, and we are going to put our stethoscope in. Something else I noticed that nursing students weren't aware of, when you put a stethoscope in, it should be facing towards your nose. If the stethoscope buds are facing back towards your ears, it's actually not going how you want it to go into your ear canal. So make sure your stethoscope faces towards your nose. I'm going to check, and I want to use the diaphragm. It's actually not on the diaphragm. I tap it, I hear it very well. And I like to hold my stethoscope with my left hand and manipulate the blood pressure cuff with my right. However you're comfortable with, but that's my preference. And look how I'm holding the stethoscope. We're not putting our thumb, we're holding it to the side. So if you don't mind, we'll put your arm right there, and you can just relax it. So righty-tighty, we're gonna inflate to 160 for Miss Rago, and slowly very good. So Miss Rago, your blood pressure is actually slightly lower than normal. Your blood pressure right now is running 110/72. Is that okay for you?
Yeah.
Yes. Okay.
That's fine.
All right, so I'm gonna first place this on my patient's arm. First of all, I have her arm here on the desk, and I'm doing her left arm. You want to be consistent, so whatever arm you normally do, or whatever arm your patient normally gets their blood pressure checked on, you want to stick with that arm. So there's an artery marker here, so I want to make sure that I align this with the brachial artery here. So I'm going to put this on her arm just like this, and I'm aligning it with her brachial artery. Now when you put this on your patient's arm, you want it to be nice, you want it to be snug, right? But you don't want it to be so tight that it's already hurting your patient, because once you start pumping this up, it's going to get tighter. So you want it to be tight enough that it's not moving up and down, but not so tight that it hurts your patient. Is this okay?
Yeah.
Okay. So you want to put that on there. Now that I've put the blood pressure cuff on her arm, Now I'm gonna put my stethoscope on. And before you even go to check your blood pressure, make sure your stethoscope is working. You wanna test your stethoscope by tapping on the diaphragm. When you tap on this diaphragm, if you're not jumping because it's so loud in your ears, it may not be on. So you may have to twist it and tap it again. And then actually when I twisted it that first time, I actually turned it off. So you wanna twist it and you should jump. If you hit on it hard, it should be so loud in your ear that it makes you jump a little bit. That's how you know that it's on. All right, so I'm gonna place the diaphragm of my stethoscope on the brachial artery. Now, how do I know what a brachial artery is? Because I can feel her pulse there. Now, where you feel her pulse, this is where you're gonna place your stethoscope, okay? So I'm gonna place my stethoscope here. Now, when I'm testing my students and I see them with the stethoscope all over here, I know they're not hearing nothing because the brachial artery is not over there. You're not gonna hear anything. So you wanna be here on the brachial artery, right? Now, I want you guys to remember this, righty-tighty, lefty-loosey. So to tighten this up, you're gonna twist the bulb over this way to the right, okay? So I'm tightening it up and this up. So now, one thing I wanna make a note of, do not cover this with your thumb, okay? You wanna avoid covering this with your thumb. Remember, your thumb has a pulse, so you wanna avoid using your thumb to check pulse, as well as having it here while you're checking blood pressure. So you can hold it like this, or even like that, okay? So I'm gonna hold it just like this, and I'm gonna tighten this up by twisting this all the way over to the right. And then when I'm listening for her blood pressure, I'm gonna twist this slowly. And remember, as you're listening, that first sound that you hear, that's gonna be your top number, okay? And so wherever this needle is pointed to when that sound comes in, that is your systolic pressure, your top number, okay? As you're listening to the heartbeat or Karakoff sounds, when that sound goes out, whatever number that this needle is pointing to, that is your bottom number or your diastolic pressure, okay? So let's go ahead and listen. So I'm gonna tighten it up again. And I'm gonna go up till about 180, okay? Now I'm up to 180, I'm gonna let it down slowly so I can, I'm not too slow, but slow enough so that I can catch that top number. Okay, so I heard it at 104. That's gonna be my top number. And then I stopped hearing it at 70. Okay, so once I get that bottom number, there's no need to let it come down slowly. Just let the air out once you get that bottom number.
This is tight. Okay. So I'm just gonna have you put your hand down here. I'm just checking to see when the radial pulse is gone. Okay. Now I want you to raise your hand and pump your fist 10 times, just like that. Okay. Just gonna balance. So just relax. Okay. Blood pressure is also on the lower end, but it should be normal for you considering you're healthy and very active.
Just let your arm relax as best you can. Okay. So it's going to tighten and then gradually loosen. When this is done, we're going to check the blood pressure in your other arm too. Have you had any fast or slow heart rhythms at all recently? Any changes in blood pressure that you know of? Okay. Can you feel your pulse pulsating through the vessel? Great. 128 over 75. Perfect. Let's do the other arm. All right. You're ready? Check it again here. Here we go. When somebody takes your blood pressure, do you ever get cramping of your muscles? Great. Great, 126 over 77. And so, place it. Okay. So, you can go ahead. Is your arm resting? Just let it rest as much as you can. And notice it's right around the level of your heart. We want this to be right there. So, does it feel pretty relaxed there where you're at? Okay. Very good. 125 over 78. All right. I'm going to move over to your other arm. Do the same thing here. $120.75. So that's perfect. All right, very fine. So let's go ahead and start this. You just let me know if it's ever too uncomfortable and we'll stop the exam. Sometimes if people have had issues with spinal cord injuries in the past, or they've had head injuries, or they've had previous strokes, the blood pressures are different on each side of their body. And so checking this just kind of gives us a clue. 122 over 70, 126 over 72, that is within normal. So your nervous system is doing its job. What we're going to do now is the blood pressure's on your arm, so we're going to check the blood pressure on your arm and then on your leg. And by comparing the two, we can calculate really if there's any indication you have peripheral vascular disease. So I'm going to first take the blood pressure in your arm, okay? You'll feel me I'm going to feel your pulse here, see where it disappears. Okay. All right, so right around 120. So now I'm going to check your pressure. Okay. (138/75). Okay. Now I'm going to move this cuff down to your leg. Now as I'm feeling the pulse of it's called your dorsalis pedis pulse, and I'm just feeling how strong the pulse is. I'm going to first check to see when that pulse disappears when I blow up the blood pressure cuff. Okay, right around 140. And then it comes in good. Now what I'm going to do is, feeling the pulse, I usually don't pick it up or feel it as long as I would if I used a stethoscope. So what I'm going to do is I'm going to use a stethoscope. First the bell, I'm going to do the same thing. You hear different sound frequencies depending on what part of the stethoscope you use. Great. I'm going to listen to it one more time, but with the diaphragm. Diaphragm picks up higher pitches sound, so sometimes we can hear some subtle things in the higher pitches. Great. So you can hear, I'm going to repeat this, but with the Doppler, and you should be able to hear a little bit what I'm hearing. So we'll do that next.